with really a common goal of improving performance status through several different means to get patients in better shape for treatments. So this is an approach that involves rehab services, dietitians, smoking cessation, social services. So there's a lot of touches along the way from this team, all really with, again, that same common goal, and that's to get patients feeling better, getting stronger prior to surgery or any cancer treatment. So, one of the things that we found more and more that we're seeing in oncology through our multidisciplinary treatments is that patients are getting treated with chemotherapy and radiation for a period of time before they ever see the inside of an operating room. And that's really a period of time that we see a lot of value, not just in receiving cancer treatment, but also to build patients up and to improve their performance status in anticipation of an operation. So what we've seen, and this has been reflected in the literature through several trials now, is that if you're able to get patients to a certain degree or physical stamina or performance status before surgery, they'll do better as far as their outcome. When patients come into surgery kind of down here after being through chemo and radiation, everyone takes a little bit of a hit with surgery as far as, being a little deconditioned and their nutrition being off. But obviously, if you can come in at a very high level for surgery, your ability to rebound and get through that postoperative period and have a better outcome is really improved. And that really makes a lot of sense in the field of oncology, because there's a lot of perioperative treatment, so treatment happening after surgery as well. And if patients are recovering quicker and having better outcomes, then they get back onto treatment quicker, and overall their oncologic outcomes should improve. So that's really the focus of this group and this panel. And I really want to thank the other panelists here for everything they're doing, Dr. Cohen and Kate and Carrie, for all the time and commitment that they show to the patients. So that's kind of just an overall, I'd say, about Prehab and what it's about. So certainly, if others have input too, that's great as well. I know we're sending a lot of patients over to you, Dr. Cohen, and I really am grateful to the services at Marianjoy. It's a world-class facility with great resources. So thank you for really showing an interest in these patients and the remarkable work you've been doing with our patients. We appreciate all that. So maybe it's a good time to talk about your role on the team and your philosophy approaching these patients.
Oh, thank you. I very much appreciate it. It's been a tremendous honor to participate in the care of these patients, and I'm very committed, and the staff, the fabulous therapy staff that I work with and the psychology staff that I work with is very excited about the opportunity to be a part of care for these patients. And I want to really just echo a lot of the points that you have made. Cancer prehabilitation is a multimodal approach, and certainly in addition to nutrition, medical optimization, and physical fitness, that's very important. The other crucial component of this is psychological and coping with stress and stress management, and we are committed to bringing all of those pieces together. I want everyone to know that this is a fabulous team, and we are constantly in communication with each other, sharing what we have learned when meeting with patients, working together to optimize care. And we're right now in the process of working with the therapy staff and the therapy team leaders to facilitate patients coming in to receiving therapy. So we're trying to streamline this process to reduce any delay in getting people into care.
Kate, do you want to talk about your role on the team as the dietitian, and especially in GI oncology? I think that role is never so visible as the work you do, because obviously as the cancer takes its toll in the digestive tract, it's you've really championed the nutritional aspect to really push these patients to be able to tolerate treatments and sustain themselves. So if you could say a few words just about your approach to these patients.
Sure. I think, like you said, a lot of these patients are going through neoadjuvant treatment before getting to the surgery part. So a lot of them are going through nutrition symptoms, nausea, vomiting, things that can definitely lead to malnutrition. So consistent following of these patients as far as their nutrition throughout that time is really important. Anyone that is going into surgery, we want to make sure they're having adequate protein, adequate calories, vitamins, minerals to help with that healing process after surgery. So making sure that we're improving any malnutrition that maybe was at the start of the diagnosis, or making sure they're just holding their nutrition throughout treatment is really important.
Sue, are there some questions that we could?
I do have some, yes, and you know what, if everyone anyone can unmute at this point, and we'll open this up to Q&A, but I do have quite a few, so I'm going to start out and I'll put my camera on here. One of my top questions is, do all cancer surgeries include some type of prehab program at NM? Is it across the board? Is this something new?
I could speak to that. I mean, I think at this point, I wouldn't say it's universal, but certainly there are pockets of patients like GI oncology, head and neck patients, where treatment can be somewhat debilitating as they're going through it, and where oftentimes the end of treatment is the culmination of where surgery is then being utilized. And so I think in those instances, those are really, that has been the patient population we really identified as those that can really benefit from prehab. I think anyone though with any barriers or challenges facing them when they're going through treatment or a surgery would be a good candidate. So folks that are, smoking, that need to go through smoking cessation, folks with, like Dr. Cohen mentioned, any kind of psychological or emotional limitations. Going through cancer treatment is a very, I would say, taxing, emotionally very taxing experience, not just for patients, but for families and everyone involved. So, I really think that there's a role for prehab for just about all patients. But at this point, I'd say it's not being, let's say, universally offered. But I could definitely see a time in the future as we start to appreciate and understand the outcomes that we're seeing, with current programs, that this will extend out into other disciplines. But to answer your question, I wouldn't say it's for every patient at this point, but certainly looking to expand this in the future.
Got it. Anyone else have questions? I have more questions, but does anyone else have questions? You can put them in the chat, or you can unmute. Feel free to ask anything at any time.
I would just like to add to what Dr. Abad has said. The literature is actually shows that for many cancers, not just for the ones that he had mentioned, that prehabilitation is of tremendous benefit, and it can be started at any point in the cancer care continuum. There is many opportunities to improve one's health optimization, improve their cardiovascular fitness, their nutritional status, their resilience in terms of the psychological stressors, and there's really no bad time to actually enter into this multimodal rehabilitation program.
I'm curious if, okay, I'm a patient and I would like to, I'm listening, I want to do prehab. How do I get a referral from my oncologist? How do I ask that I receive these services if I think I qualify?
Yeah, I could answer that from the oncology standpoint. I'd say, because of our partnership with Marianjoy, this is in the kind of front of our minds as we see and approach patients. And so that's something that we oftentimes will bring up, but I'd say that's not, again, a universal practice. So I'd say for patients that are, seeing a medical oncologist or a radiation oncologist or even their primary care doctor, and they're going through, oncology related treatments, or, even globally, this is applied to other, even non-oncologic specialties too. But, there's obviously a place for prehab in a lot of different disciplines. But I think any one of those people along the way, a primary care doctor, an oncologist, can make that referral. It's, even if a patient is being followed by a physical therapist, or, they could also, make that known that referral to rehab services is being requested. So as far as from your standpoint, Dr. Cohen, who would you say you get most of these referrals from? Is it from the oncologist, or do you get some from the primary care doctors as well?
Right now, most of the referrals are coming from oncology, but I have also gotten patients referred through therapy, primary care doctors. It really runs the spectrum. So there really shouldn't be any barrier to coming to be evaluated for prehabilitation.
Kate, I've got a question for you. When should someone see a dietitian during cancer, prehab? Is it, would your oncologist kind of guide that, or is it something you should be proactive about?
I think it's beneficial to have a meeting with a dietitian, maybe at diagnosis as your care plan is being put together, because then that way, we can identify any nutrition concerns or, changes in nutrition status prior to the start of treatment, so that we can work on that, throughout the whole process. And then, definitely meeting with the dietitian, when there's talk of surgery, to see what we can do, in those weeks coming up to surgery as well.
Got it. Okay, it's a quiet bunch out there. Anyone have questions? I still have more, so beware.
Beware.
It doesn't look like there's any in the chat, but feel free to put questions out there or unmute. Okay, one of my questions is, how personalized is a prehab program? Does one size fit all? I'm guessing one size does not fit all, but then how do you assess what someone needs versus, one individual versus another individual?
I guess
I don't even know who, I feel like all three of you can probably answer that one. Yeah.
I think that's a good one for Dr. Cohen.
Okay, I'll raise my hand next time. Okay, sorry. Okay. It's definitely individualized. When I have seen patients for the first time, obviously we review medical history, talk about, prior and current physical functioning. We've talked about, we go in depth regarding, history regarding, any pulmonary or cardiac issues. We talk a lot about barriers to participating in an exercise program, such as arthritis, neuropathy, other types of pain, any prior other issues that have happened in the current or recent that may be limiting their ability to participate in therapy. For example, I've had several patients that have had spinal surgery for different reasons, and so that sometimes can limit their ability to walk carefully and participate in a walking program. So we review all that, and we do an exam and come up with an exercise plan. And this is something that we share with the therapy staff. So we work together on trying to achieve certain goals. And, you know, we, per our specialty, identify maybe other issues that need to be addressed in order to improve patients' strength and cardiovascular performance. Right now, we are putting more emphasis on, you know, cardiopulmonary fitness, particularly in preparation for surgery. But obviously, for patients, there are, you know, we also have to address barriers to actually participating in an exercise program in general.
Would that exercise, Dr. Cohen, would that be done at Marianjoy, or is it like prescribed and then you go home and you do it? Or is it both?
Well, as you know, being involved in cancer treatment involves many appointments, and one of the challenges that patients and their families have is how to go to even another appointment. So our goal is to get them into a home exercise program as quickly as possible, so they have control over their schedule and optimize their ability to actually perform exercise. So depending upon their physical performance in terms of walking and their baseline level of exercise, some patients, you know, need just 1 or 2 visits with a therapist to kind of go over an exercise program, address questions, and they could take that exercise program to their home and be independent with it. Other patients have more complex impairments that really require more visits, one-on-one visits for a therapist to address those issues. And so it's tailored in that respect.
Okay. Makes sense. Yep.
The goal for everyone is to be able to execute a home exercise program. And the goal for all patients, regardless of where they are in their cancer journey, is to work to improve their endurance so they could perform in a 1 week's time 150 minutes of moderate intensity exercise. So that can look like many things, like walking, cycling, you know, dancing, etc.
Got it. Let's check. See, no other questions are coming in. Anyone have any questions? Okay, I've got one more that just popped up in my head. So the prehab program, would it also be designed to then be the rehab program? You know, does it kind of flow right into after surgery, after radiation? Is it pretty similar, or is it completely different?
That's an excellent question.
Yeah, or is that just so tailored to, you know, personalized? So that's,
well, one certainly flows into the other, and the goal of prehabilitation is to reduce the you know, the post-operative complications, and to enable people to return to their baseline level of functioning as quickly as possible. And there's very good evidence in the literature that prehabilitation program can achieve those goals. Sometimes after surgery, there were post-op surgically specific issues that need to get addressed, and so in that sense, the program is different, but they should flow into each other. They shouldn't be. They should be intertwined.
got it. Okay. Any other questions out there about prehab? we must have really covered things. Anyone, Dr. Cohen, Kate, Dr. Abad, is there anything else you want to add about prehab?
No, I mean, I think it's really, the way I see this also is, especially for oncology patients, when you're given a diagnosis like cancer, there's this feeling of loss of control to some extent that patients have where, you're trusting your health, your life to a group of providers, to treatments that, have somewhat, side effects and we're talking about, very involved invasive surgeries at times. And I often hear from patients, I just feel like my world is spinning out of control and I've lost control. What can I do as a patient to really, take control of my life, my future? And this, I think, is just such a perfect opportunity for patients to really focus on something, their overall health and their strength, and to approach their day-to-day life with cancer with a purpose and a mission. And I often tell patients, we approach surgeries in oncology like a boxer approaches a fight or a marathon runner approaches a big race. It's, you train up for it. You put the time in, because the time that you put in now will make your recovery that much better. So, I feel like that's a very empowering thing, and it's something that they include their family in on, and they identify gaps in their health, like if they're smokers, the need to cut down on smoking. If they're heavy drinkers, the need to, control that as well and cut down on alcohol, or if there's, social barriers, or, psychological barriers too, and to really try to get those things, addressed and taken care of with the support of those around them. That's really what the whole program is trying to accomplish. It's to almost, make you a better you, so you can fight this, cancer as best you can. So, and I think it is, for a lot of patients, a very empowering process. And in a time where you really do feel like you've just lost control, and your world has completely been turned upside down. So that's a lot of the conversation that I tend to start with patients when I introduce, the power of prehab.
That was excellent. Is there a timeline for prehab? How do you know when somebody is, okay, we're ready? Is it just based on their, weight or, dietary habits? How do you know? Or is it their body? Because, cancer is, it's time.
Yeah, I look at it as the earlier the better. Even a couple of, let's say they needed surgery up front, even a couple of weeks of important lifestyle changes can make a difference. But certainly when, the way we are treating patients these days with, extensive preoperative treatment, there's this, oftentimes it's several weeks or even months where we can invest this time wisely to get them stronger. So I'd say, to answer that question, any time is time well spent. I'd say the more time you have available, it's probably better in general. But certainly it just depends a little bit on the treatment plan and all of that. There's been patients where I've seen after treatment where they're still not quite ready for a big surgery, where we will put them through more, rehab in order to build them up, or work on their nutrition, have them see Kate and work with Kate to boost their nutrition or optimize, their strength prior to surgery. So it can, like I said, it can be a very powerful tool for us.
Got it. I do have a question that came in the chat. Veronica is asking, do you think prehab equips patients with a realistic expectation of surgical outcomes?
Great question. I think that obviously it depends on their expectations, and that depends on those conversations they're having with their oncologists and their surgeons about their disease, foreseen limitations following surgery, the ability to recover, and the time frame to do that. And I'd say that's a very personalized conversation too. What I describe for some patients as far as what I see as their outcome or their expectation of how they're going to do after surgery is not one size fits all by any means. And some patients were very clear up front. We see that you're going to likely need inpatient rehabilitation services following surgery. Other patients, we say, you're going to go home, expect you to go home after surgery, and you may need some postoperative, physical therapy as an outpatient or none at all. So it really just depends on the type of surgery, the type of disease, and any comorbidities or limitations that they may have.
I think we've exhausted all questions, unless anyone else has one. Oh, thank you so much. Thank you for everyone for joining, and I just want to thank Dr. Cohen, Dr. Abad, and Kate for being on as our panelists today. This is a really interesting conversation that I think will continue to blossom in many different disciplines. So I'm really excited about it. I think there's actually an article about this in our NM feed this morning and in the news feed. So pretty cool. Yep. So thank you so much, everybody. Have a great weekend, and thanks for joining. Yes.
Thanks, Sue.
Thank you so much for having us.
Yes.
Thank you.
Bye, everyone.